is cognitive behavioral therapy, CBT, for schizophrenia. There's a lot of research to back this one up. So CBT for schizophrenia, it involves using a collaborative therapeutic relationship. So it develops a shared understanding of the problem. There's lots of goal setting, and it teaches the person techniques or strategies to reduce and manage their symptoms. It's typically therapy is going to be conducted in individual sessions, and they're going to be time limited. Usually several months will be the time limit. The goal is not to cure schizophrenia, but rather to improve the person's ability to function independently by themselves, to manage it, and to reduce the distress that they're going to face in their everyday lives. So more specific approaches with CBT, this cognitive behavioral therapy, is going to be cognitive restructuring, behavioral experiments and reality testing, self-monitoring, and coping skills training. So there's going to be unique considerations here with treating schizophrenia. So emphasis on being non-confrontational and on normalizing psychotic experiences, in so much as they are on a continuum with non-psychotic experiences. CBT for schizophrenia can focus on psychotic symptoms, so things like hallucinations and delusional beliefs, which I discussed on an earlier video. But it has been shown to be helpful for addressing depression and anxiety associated with psychotic symptoms and their impact on the person's life. All right, another treatment here is cognitive remediation for schizophrenia. So family psychoeducation, which psychoeducation is something I mentioned, refers to... Oops, sorry. Read off the wrong one. Let's go into the cognitive remediation real quick here. So cognitive functions, things like executive function, learning and memory, processing speed, and sustained attention are frequently impaired, and they play an important role in the functional impairments that are commonly seen in schizophrenia, right? So the cognitive remediation, or CR, they're designed to improve cognitive function through a repeated practice of cognitive tasks or strategy training. And these are going to be time limited. They're typically time limited. They can be conducted individually or in groups. Some involve an extensive use of computers, while others focus primarily on paper and pencil tasks. So it really depends on who you're going to for this. Most of the time, it's going to take into account the motivational and emotional deficits that are often seen in schizophrenia. And the goal of CR is to improve cognitive function. So there has been research that shows that small to medium effects of CR on neuropsychological measures of cognition. However, whether these improvements are sustained or whether they translate into improved functioning remains unclear. Let's go into family psychoeducation. This refers broadly to a number of different models of treatment in which family members of a person with schizophrenia participate in and are the focus of intervention. So this one, kind of hence the name, family psychoeducation. The family members are going to be involved. There's patient-centered goals. Some of these goals might include maybe goals with relapse, fewer hospitalizations, and improved outcomes for the person that has schizophrenia. Other family-centered goals are going to be to reduce the distress of dealing with that family member's mental illness, improve patient-family relations, and decrease the burden of mental illness on family members. So there's going to be goals for that person that has schizophrenia, as well as family-wide goals for everybody in the family. It's going to incorporate education about schizophrenia, so learning about schizophrenia, assistance with crisis intervention, problem solving, emotional support, and communication skills training. For this, it's going to last at least 9 months, so at least 9 months typically, and it's going to be conducted with individual families or in multi-family groups. So again, it depends and it's going to include a focus on family strengths and resiliency. So their strengths and how they can bounce back. Okay, illness management and recovery, IMR for schizophrenia. So this focuses on teaching illness self-management in persons with serious mental illness. The emphasis is on recovery by helping clients set and pursue personally meaningful goals. So it combines psychoeducation about mental illness, cognitive behavioral approaches to medication management, planning for relapse prevention, social skills training to strengthen social support, coping skills to manage symptoms of mental illness. And all 5 of these elements have been studied in depth. The combination into a single intervention package has only undergone preliminary evaluation, so there's not a whole lot of research to back here. Another treatment, and I know this is a long video, but bear with me, there's a lot of information in here. Token economy programs or social learning for schizophrenia. So these are used in long-term care setting. An example would be long-stay inpatient units in residential care units, but they can be adapted for shorter treatment programs as well. They are comprehensive behavioral programs, and they're based on social learning principles in which the participants receive reinforcers, perhaps points or tokens for performing clearly defined target behaviors. This one's kind of interesting because, like it says, participants receive reinforcers, and as a special education teacher, that's something I use a lot in my classroom, positive behavior support. So rewarding positive behaviors. So when they use tokens or points here in my class, I use stickers on individual sticker charts and class-wide stars. And I've noticed in my classroom that works wonders in reinforcing behaviors. So it's interesting to see that used in this social learning or token economy programs for schizophrenia. We have a few more here. Social skills training, SST for schizophrenia. This uses principles of behavior therapy to teach communication skills, assertiveness skills, and other skills related to disease management and independent living. This is typically conducted in small groups and are ideally led by 2 co-therapists. So that's kind of interesting, co-therapists working together. It's kind of similar. I co-teach a math class for my 4th graders with learning disabilities. So it's interesting to see a social skills training that involves co-therapists working together to try and bounce ideas off each other and do the best that they can for their clients that have schizophrenia. Supported employment for schizophrenia, and hence the name. This approach is vocational rehabilitation adapted for these individuals that have a mental illness. And they're trying to integrate employment along with the mental health services and get individuals into jobs into the community. So this method really interests me, and I do like it. The last one here, so I'm going to end this video right after this one. Acceptance and commitment therapy for psychosis. So ACT, it's a behavioral therapy, and it's based on relational frame theory. Relational frame theory, it's a theory of how human language influences experience and behavior. Aims to change the relationships individuals have with their own thoughts and feelings, memories, as well as physical sensations that are feared or avoided. Acceptance and mindfulness strategies are used to teach patients to decrease avoidance, attachment to cognitions, and to increase focus on the present. So this method is called acceptance of commitment therapy for psychosis.